Congresswoman, we're live and you can get started.
Okay, thank you all. And let me welcome everyone today for this press conference. And let me just put it in context of what we're doing around the country. Actually, this is one of many events to try to make sure the public understands the necessity for the American Rescue Plan to be passed. We're with some key community leaders from my district to discuss the dire need for this relief in the East Bay. And I would just like to thank our participants, Sherry Hirota, who's the CEO of Asian Health Services, Adrian Henderson, who's the owner of Kingston 2, which is a great Jamaican restaurant in downtown Oakland. We have Chris Iglesias, CEO of the Unity Council, and Susan Bateson, who's the executive director of Alameda County Community Food Bank. And I just want to say to all of these who are with us today, all of our individuals and my friends and colleagues, they're on the front lines and they see the suffering and the pain in terms of people's lives and livelihoods and understand why we must pass the American Rescue Plan. Couple of facts I just want to mention. First of all, tens of millions of Americans have been infected, and we recently passed the tragic milestone of having lost 500 lives to the virus. These are human beings whose lives have been lost. It's tragic, it's heartbroken, and we've got to stop this pandemic. The lives and the health of our communities and individuals is at stake. Also, on top of this pandemic, in my community, I know we have a pandemic upon a pandemic because we have thousands who have plunged into poverty, who were living just on the edge, now living below the poverty line. Nationally, over 18 million Americans are receiving unemployment benefits. That nearly 24 million Americans are struggling with hunger, and an estimated 12 million children living in households with food insecurity, which is up to 40 million people who cannot afford rent and fear eviction. And of course, in my district, this is a serious problem. Over 2.3 million women have been forced to leave the workforce entirely, including 1 million mothers. And 8 out of 10 minority-owned businesses are on the brink of closure. It's really heartbreaking to see what has transpired over the last year. And the response, unfortunately, in the last year has been little to nothing, has been totally, lacking on what needed to happen from the administration. The Congress, we've been on the case, we've been fighting hard. You know, we passed the HEROES bill. We passed, got stuck in the Senate. We did pass a couple of CARES bill. And so we finally passed a survival package, and now we have a rescue package. And so we're going to talk now about the importance of this rescue package. And I just have to, again, thank our local leaders who are on the ground, making sure that people's lives and livelihoods stay intact. But also to Speaker Pelosi, because she has been such a great leader in making sure that we tried to work in a bipartisan way, tried to make the $1.9 trillion package such that Democrats and Republicans could vote for it. But we can't wait. We had to put this through the reconciliation process because people are living on the edge, and they deserve their government to step up and provide that safety net for them. So thank you all again. And I believe, Sherry, I'll turn it over to you. And then Sean, my staff, and I want to thank my staff for pulling this together very quickly, and the press. Sean will take over and introduce individuals after Sherry. The order will be Sherry Hirota, Chris Iglesias, Susan, and Adrian Henderson. If Susan is not here, Adrian, you'll be able to go right after Chris. Okay, Sherry, thank you very much.
Thank you, Congresswoman. Thank you, Congresswoman Lee, for your great leadership. And in this time of pandemic, it has been critical to have Asian Health Services as a trusted healthcare provider in our community. And I say that normally I'm more modest than that. But along with 8 other community health centers in Alameda County, we have provided hundreds of thousands of COVID-19 tests and tens of thousands of vaccinations. Last week, Asian Health Services had a tremendous successful mass vaccination of over 1,000 elderly patients who rely on our services in 8 different Asian languages. We, as a whole, average at our clinic 1,300 vaccinations a week. It's part of the mission of community clinics to serve the most difficult to reach. In our clinics, 90% are low income, 90% are people of color, and at AHS, 90% are limited English proficient. Our communities have been disproportionately impacted by COVID-19, and at AHS in Oakland, Chinatown, we've witnessed an entire community go underground for over a year. We feel that we were simultaneously blamed and ignored in the midst of this country's greatest pandemic. So people are hungry. They've been shuttered out of jobs, bankrupt small businesses. Our people are isolated and depressed. At AHS, we initially lost 80% of our services. We could have retreated, but instead doubled down. The clinic invested in new laptops, iPhones, and remote monitoring equipment overnight to ensure that patients with nowhere else to go had a lifeline. So we're now providing 70% of our visits through telemedicine, and 50,000 people rely on the clinic because we speak their language, understand their culture and health beliefs, and because we provide quality of care. But we have stretched our resources to keep our community safe and healthy. We've tested and vaccinated, informed our community of health information they desperately needed in languages that most government and private vendors have overlooked. The American Rescue Plan will help bridge the destruction, the shortfalls, and ensure that the infrastructure of our health centers across the country are rebuilt so we can help our communities recover. We are anticipating with great faith that the American Rescue Plan will be passed. Healthcare for all has never been more important. We must move to bridge the digital divide, language barriers, and create more dental, essential mental health, prevention and primary care, and to begin to heal our country. So thank you, Congresswoman Lee, for all your leadership.
Thank you very much, Sharon. I just want to say that your leadership of the Asian Health Services has really shone a light on what exemplary services community health clinics and community health centers provide. And in our package, the American Rescue Plan, we have made sure that community health centers are part of the overall funding priorities because, again, in my district, our community health centers have led the way, and you certainly were in the vanguard, 40 some years ago. So thank you so much.
Thank you.
We'll now turn it over to Chris Iglesias, the CEO of Unity Council.
Yeah, and excuse me, let me just say, I see you, Susan. Susan's on here now. She wasn't on my screen in the past, so Susan will come after. So after Chris. So thanks again. Okay. Sorry, Sean.
So good morning, Congresswoman Lee. We're glad to be here today with you and the other and our other partners here in the East Bay. And really, again, thank you for your leadership. It's good to see you. I'm glad you're okay because what happened on January 6th was really a disgusting thing to see. But I'm glad you and your staff is okay. That's the number one priority. So as far as the recovery bill, I can't emphasize enough how urgent it is to get this thing passed. You know, we have been like my partners here on this call on the front line since day one, since the shelter in place started almost a year ago. We've seen the devastation of this pandemic and the civil unrest that happened over the summer. But I think many of us know that we were already in crisis mode before the pandemic hit, especially around housing, affordable housing, workforce opportunities. And the pandemic is just exemplified everything, right? It just made everything just much worse. I am really proud of the way the community has come together to address the crucial needs, the basic needs in the community around food, housing. In Fruitvale and in East Oakland, we've had about 18 organizations come together to form the Resilient Fruitvale Collaborative, We've recently put in a request to the county for $70 million. I mean, instead of like waiting for the county to say, this is what we're going to do, we've gone to them with a plan. We've mobilized and work that we've already been doing. So we know that that's happening. Now, what's happening is that the county is telling us that they need to see what's going to happen in Washington before they can start releasing additional funds. So I know that puts a lot of pressure on you, but that's how urgent it is. I mean, we need this to move so the county can move, so the cities can move. We need to get these resources into the community ASAP. You know, I think there's a reason that we're all at home right now, because somebody is working, and that somebody is us. We are the essential workers out there that are putting ourselves, you know, out there on the front lines every single day. All of the organizations here, for the FQHCs, for the community health organizations, I totally agree. They have been amazing. Asian Health Services like Clinica, Native American, Roots. I mean, you are blessed to have them in the organizations, because they have stepped up in a big way. But again, we are still dealing with the basics. We're still just distributing food, which I'm sure Susan will be able to tell you. We're doing rent relief, but right now we have waiting lists that are enormous, that people need this right now. And in about 45 minutes, we are sending a semi truck from the Dreisbecks from Oakland are sending a semi truck to the Mission District in San Francisco to pick up 1,000 boxes of more food to bring back to the Fruitvale Transit Village this afternoon, because we've already used all of our allotment already for the week. So we need actually more food. That's kind of where we're at. That's like a barrio feeding a barrio. So the urgency of this bill we just can't stress enough. And again, I want to thank you for your leadership. I think you have a model of how this recovery works from a community-based organization standpoint that I think could be used around the country. But again, thank you for your leadership, and let's help you get this thing passed.
Thank you, Chris. And let me just say, the pressure is good. We feel the pressure. We should feel the pressure, because people's lives and livelihoods are at stake. So thank you.
Now we'll hear from Susan Bateson, Executive Director of Alameda County Community Food Bank.
Hello, Congresswoman, and it's an honor to be here today to represent neighbors in Alameda County. Alameda County Community Food Bank, which you know is located in Oakland, now provides enough food to serve 75,000 neighbors daily. A year ago, we served less than half that number. We are in full support of the American Rescue Plan. We have our hearts broken by stories from community members. In their voices, we hear their desperation, being thrust from housing, living in cars if they have them, homeless seniors living out their golden years at the mercy of society. Our emergency helpline manager, Miriam, regularly takes into her heart stories unlike she has heard in her 20-plus year history with ACCFB. She told me about a community member who called our helpline describing their family, parents and children evicted. Her husband unable to afford insulin. When his blood levels render him in a life-threatening state, they have no alternative but to rush him to a local hospital emergency room just to get insulin. But this is a cycle for their family, like their homeless days and nights, like searching for the next meal until they find someone like Miriam to bear witness. There are more than 400,000 of these stories in Alameda County alone at this very moment. But how long can Miriam listen to these stories without harm to her heart and her psyche? How long will young families be forced to live without shelter or proper medical care? ACCFB is running a direct food distribution. It's a contactless drive-through from a wonderful county-owned building that Alameda County officials have turned over the keys to us free of charge. It's across the freeway from the Oakland Coliseum, where just 2 staff and a dozen or so caring volunteers just provided our 5 millionth pound of food to community members who thread their cars through a parking lot 3 times a week. When I go to the food bank, I drive by cars lined up on Oakport Road at 7 a.m. just to collect groceries for themselves and at times their neighbors who lack transportation. Each day, a car battery dies as they wait. Our team of staff and volunteers are ready with jumper cables. You know, across the freeway is the new vaccination clinic in the Coliseum parking lot. I went there a week ago. By contrast, the number of people helping thread fewer cars through was larger by hundreds. The Coliseum Vaccination Clinic put into context for me how much can get done. 6,000 shots a day when government puts their collective minds and energy to it. That kind of action is what this rescue plan will do for neighbors in line at Oakport. I also thought as I waited to get my first vaccination, the vaccine clinics will be gone long before the lines of people needing groceries at emergency drive-thrus and at distribution at member agency partner sites located throughout the county. It's no secret that the pandemic has laid bare the effects of race, place, and class on health outcomes. Neighbors of color here and nationwide have been disproportionately affected by the virus and poverty. It makes me wonder, which is the real pandemic, COVID, racism, or poverty? Poverty lived here generations before COVID. Long lines for food resulting from closed businesses started before hospitals were maxed out. Those same lines will be just as long once we're done wearing masks and we can embrace loved ones again. Passing the American Rescue Plan, immediate relief children, adults, and seniors in Alameda County and across the nation desperately need now. Although I'm one food bank leader, I've been involved in food banking for 25 years. My bonds with other food bank leaders across the country are strong. We feel each day the desperation of community members, not only here, but in Wisconsin, Ohio, Pennsylvania, Texas, and across the nation, where 200 food banks like ours are fighting for the lives of millions of Americans who the Senate is now debating over whether they are worthy of something as basic as a nutritious meal. And I ask, really? Frankly, we're tired. Our staffs are exhausted. In food banks, thousands of community partners across the country, their lives in danger, and have been for an entire year. We're there just to make sure children, adults, and seniors have the nourishment they need. Many of our partner agencies are run by our elders, community members who are so vulnerable themselves, and honestly, I don't know what we'd do without them. They are true community heroes. Last month, the shortest month of the year, with our amazing and steadfast community partners, we collectively distributed the most food in 1 month in ACCFB's 36-year history, 5.2 million pounds. When I came to ACCFB 20 years ago, an epic year would have been 10 million pounds. Thinking about the Senate's opportunity, there are many elements in the American Rescue Plan that will help food banks so that we don't have to carry the full burden. SNAP increases, we must hold on to the 15% increase in SNAP food benefits for the duration of the pandemic and during the economic recovery. PEBT, wow, this smart, proactive program literally saved families this year and nourished children who would have slipped through the cracks. We need this. Families need this. In short, it's a lifeline. WIC, a godsend to families with young ones and expectant and postpartum mothers, TFAP, and government food programs. We particularly want to call out support for Black and Brown farmers included in the package. We're grateful to you, Congresswoman Lee, for your vision, your bravery, and your heart. You, like me, use SNAP, although it was called food stamps in our day. We both shared our gratitude for this program, which helped us through rough waters. We were supported by a government that offered us support when it was most needed. And that's the opportunity the Senate has before them right now. We hope our nation's senators can truly focus on to help neighbors like us during this time, offering a lifeline, because no one should be hungry in a country as wealthy as the United States of America. Thank you.
Thank you so much, Susan. Yes, your description of what is taking place doesn't sound like America, the wealthiest, most powerful country in the world. And yes, I was on food stamps. I paid $4 a month. I think it was for $84 worth of food stamps. And it was a bridge over troubled waters. It was a lifeline, truly. And this is very personal for so many people. And it is a matter of life and death. And I'm just, it's hard to believe that we are, like you said, debating whether or not people should eat or not in a pandemic of all.
That's right.
So thank you very much. Okay, Sean?
We'll now turn to Adrian Henderson, owner of Kingston 11 in downtown Oakland.
Greetings, everyone. I want to first say thank you to Congresswoman Lee for your leadership and repping Oakland, California. You know, we are dear to our heart. I want to shout out Susan, Chris, Alex, and Sherry for the work that you all have done in our community and working with our folks who are less than fortunate during this time and this crisis. Yes, we have been hit pretty hard in regards to Black-owned businesses and restaurants in Oakland and restaurants and overall in general in terms of this pandemic. Ourselves at Kingston 11, we've lost at least 55 to 60% of our business, and forced us to really look at our business and to evaluate where we are in order to stay firm and grounded in Oakland. We've been blessed to have an amazing community that has taken part in supporting us along the way, because they feel that, after this pandemic, that when they come back to reality, all their favorite restaurants aren't going to be there, right? And they're going to be left with these corporate restaurants of Taco Bell, McDonald's, Burger King. And what's going to hurt our community is those brick and mortar mom and pops restaurants that are a part in the fabric of our community in Oakland. We've been blessed to be a part of organizations that have been helping us along the way. Eat, Learn, Play with Aisha and Steph Curry and World Central Kitchen, who have come together to support restaurants in Oakland, who have done an amazing job in keeping these doors open, right? That's been allowed us to be able to bring back some of our staff to be able to feed them and take care of them. We're responsible for families that are in need of health care, they're in need of food. We're also looking and working with other environments and groups of the homeless empowerment that's in East Oakland are feeding many and multiple people. We're working with the David Glover Center, and we're providing food for them as well. So our community has come together to support us in this process of making sure that we are able to stand in the community. But once again, we've been a part of PPP, the CARES Act. What's happening too also is that folks are getting this information late. And so if they get this information late, that means that they're not going to get access to these monies that are coming down the pipeline. And so that's happened a lot where people have been getting the information late. They haven't been to apply to the money and have therefore been able to get the money. But we've been able to get the funding and money from the CARES Act, the PPP, the EIDL. That's helped us along the way. But, like Congressman Lee said, like during this pandemic, people need to eat. Business needs to thrive. So this is like a no-brainer. Like the government needs to act fast, act now to make sure that people have access and that businesses are going to be still standing when this COVID is over. So we're looking forward to the government and with your leadership, Congresswoman Lee, to push this forward on behalf of all those who are in Oakland. So we are here fighting a good cause. We are rooted in our community and we're not going anywhere. And so we have the support of our community to push forward and to make things happen. So thank you for your leadership.
No, and thank you so much. And just know that I did talk to Chef Jose Andres from World Central Kitchen, and he kind of told me the lay of the land in terms of what he is doing with you and others in Oakland. And I just want to say, again, this is America. World Central Kitchen works throughout the world in countries where the poverty rates are off the scale and where people have nothing to eat. Yet here in America, thank goodness, Adrian and yourself and Steph and everyone has circled the wagons to try to make sure that people have access to food and to be able to eat healthy meals. So thank you again very much. I will just mention a couple of things of what's in the bill, and I'll start with the small business piece, what's in the American Rescue Package. Because we know, Adrian, and I think the statistics as it relates to African-American businesses, what is it, about 40% have gone under and probably will not be able to recover to open up when the pandemic has ended. 40%. And these are not only our business owners, but these are jobs that have been created and restaurants and services that have been provided. So what we put in the bill was $25 billion in grants for restaurants and bars, which of course are the cornerstones that make our communities whole. And we did put a priority on women and minority-owned businesses. So we put another $15 billion in for the economic injury disaster loan advance grants, which are up to $10,000 per business. and it provides additional funding for paycheck protection programs. So Adrian, the moment President Biden, I'm optimistic, the moment he signs it, we need to talk and we need to get the word out so that our minority-owned businesses and our small businesses can get in the queue right away. And so you don't have to go through what you had to go through the first time around. Also in the bill, we set aside, this has been a hard one to get into the bill and to hold, but we still have it in the bill. And I think it's going to stay, thanks to Speaker Pelosi and Leader Schumer and President Biden, $350 billion for state and local governments and territories. Sets aside $130 billion for K through 12 education, and other higher institutions, educational institutions get almost $40 billion, and we have $40 billion would go to child care providers through the Child Care and Development Block Program. We set aside $30 billion in emergency rental assistance and another, which is another relief for the homelessness population, the unhoused, unsheltered. Another $10 billion goes for mortgage assistance. And of course, 40 million Americans will help keep hunger at bay by extending that by the 15% SNAP benefit increase. $50 billion to fund COVID testing and contact tracing. Another $19 billion to increase the size of the public health workforce, which is extremely important because I worked on this to make sure that people of color are hired as trusted messengers, people who are linguistically and culturally relevant and appropriate for communities that are disproportionately impacted. So we were able to get much, Sherry, of my COVID Community Care Act in the package, which I'm really proud of because this was a freestanding bill that we negotiated. So we did get another $16 billion in vaccine distribution and for the supply chains. We also expanded the child tax credit to $3,000 per child and $3,600 for children under 6. And we expanded the child and dependent tax credits so families can claim up to half of their child care expenses on their tax returns. And finally, we have the $1,400 in cash, direct cash assistance. And we have the expanded enhanced unemployment benefits of $400 a week. So that just summarizes some of what's in the bill and why it's important. But I'll stop now and just see if the press has any questions that you would like to ask before we sign off.
And I'll remind press, if you have any questions, please use the chat function and I'll relay the questions to the Congresswoman and the other guests. I'm seeing nothing right now.
Okay, well, we covered everything almost. So, but let me just say, if anyone in the press or any of you have any questions, please. Here's one question, KCBS to everyone, in terms of the food banks. What was the question, Sean, from KCBS?
From KCBS, the question is, what specifically goes to help food banks?
Susan, do you want to answer that question?
So by the provisions that I talked about in my remarks, those will decrease the burden on food banks quite a bit, and we are in full support of that. We're also in full support of the TFAP provision. Many food banks across the country are awaiting more government food and quality government food, and we know that this bill is working on that. I don't have the exact numbers, but I will get that and send that to you.
Yes, and we'll get that also because that number has changed a bit, but we'll get that number. But believe me, there are fundings and strategies in to help shore up our food banks and to be able to help relieve some of the burden right now. Was there another question?
We have just, it looks like we're at the 9:30 mark. So
okay.
We've run out of time. If the press have any questions, please feel free to email Congresswoman Lee's staff and we will get right back to you.
Okay.
Congresswoman, if you want to close it out.
Okay, well, listen, I just want to thank everyone for taking time to be with us this morning. It's, I guess, 12:30 here in DC. And so you guys were up early, but thank you so much for this. I'm really proud of my district, first of all. We've always had so many of the systemic issues that sometimes are below the radar because we do live in a wealthy state, the golden state of California, but we have so much poverty, so much unemployment, so much systemic racism, so much so many people with underlying conditions because of racism in our public health system. We have so many of our small and minority owned businesses just barely hanging on because of the issues around access to finance and during normal times. We have so many people needing housing assistance, and the Unity Council, you all have always stepped up in terms of just how we address people who need shelter. We've got an increasing unsheltered population, and during this pandemic, it's another pandemic upon a pandemic. So I just want to thank you all for doing everything you can do, because these are your clients. They're my constituents, and they're all God's children. And you all are doing a remarkable job taking care of them. So thank you all again very much, and see you on the other side of this pandemic.
Yes.
Thank you.
Thanks, Congresswoman.
Okay.
Thank you.